Great. Well, good afternoon. It is a very good afternoon in Michigan. Very pleased with the results from the House today, passing Healthy Michigan by a bipartisan margin. So I want to compliment and thank both the Senate and the House for their hard work over the last week or two, and for a lot of work over the last few months to make this happen. I want to actually compliment the leaders of both chambers of both parties, because again, I view this as bipartisan. So again, I thank Senator Richardville and Senator Whitmer last week. I want to thank Speaker Bolger and Minority Leader Greimel for their hard work on making this happen. This was good teamwork because it's about helping Michiganders. Hundreds of thousands of Michiganders will have the opportunity for health care coverage. It's a situation that will also save all Michiganders money in terms of addressing an unmanaged, uncontrolled system with a managed system that emphasizes personal responsibility, wellness, and managed care. So this is a bright day in Michigan. Very excited to be here. Looking forward to moving forward. I want to thank the department, Jim, your team's hard work, and a lot of hard work from the administration for all their efforts to make this happen. We had a huge coalition of people supporting this. So hopefully there's a lot of celebrating going on, and I look forward to signing the bill upon my return from Asia. So with that, I'd be happy to open up for any questions.
Governor, how concerned are you this bill didn't get immediate effect in the Senate?
Well, I would prefer to have gotten immediate effect, but what I would say is this is still a victory for Michiganders, both in terms of the people getting coverage and all Michiganders. So we'll just address it. That just is part of the territory that we'll move forward and put in a good system.
Will you ask the federal government to waive any penalties for people who sign up during the enrollment period?
Well, there's a lot to be sorted out, Rick. I mean, with or without IE, there's a lot of things, a lot of hard work already going on. Again, I want to compliment Jim and his team. They've already been in regular dialogues with the federal government over these kind of issues because we've tried to be open to say this is where we're at. Now we'll go through a more formal process of hopefully getting the waivers officially done and addressing any particular challenges we might have because of the lack of immediate effect.
Would that be one of the things that you'd ask for?
I wouldn't say we'd ask for it. Clearly, it's an item to discuss to see what options are and how to handle those situations.
Director, already the Democrats are taking your $7 or $7 million a day number and extrapolating that out and coming up with a $600-some million price tag that Medicaid or that the immediate effect vote is going to cost the state. Is that a fair number? Can we go ahead and say this is going to cost the state $600 million with the Senate not doing IE?
Well, what we did is take a look at what the benefit of the state would be over a period of several years. And then we divided that into the daily rate, and it came up to be about $7 million. We also took a conservative number, and we kind of thought there would be a wrap up from $320,000 the first year to eventually $477,000. So I think it's a fair number. It's going to be an average. It might, on the first day, be a bit less, but you can get into the second month when this thing is really going to be wrapped up. You might get more than $7 million a day. So I think it's a good number.
Governor, how much are we going to save this state by doing Medicaid expansion, even though it's going to start maybe a little later than you'd want?
Yeah, the ongoing savings in terms of our budget was at least a couple $100 million out of the state budget. And that was really, we were providing coverage on some things, particularly in like mental health or 2 or 3 other areas that we were doing out of our budget that now would come out of this expansion. So that really allows dollars to be freed up for other budgetary uses.
So we'll still have maybe $150 million, something like that we wouldn't have had? How should we spend this money now?
Well, a couple things I said let's look at in terms of managing the budget is to say, can we set aside some of those dollars for essentially health savings account kind of aspect to say, let's put some dollars aside to help pay our portion of our contribution when it would become due, or if they happen to change the program in some fashion that creates other issues, then we have a buffer of resources available. The other piece is something that will go through the normal budgetary process.
Governor, the legislation includes language that it's the intent of the legislature to put that savings into the roads risk and reserve fund. Is it possible that that money is going to end up going to roads?
Could. Again, that was part of going through the budget is we created a roads, but it was also a risk and reserve fund. So that's part of the open discussion we'd have going back to this point of what might be put in a savings. Could be rainy day fund, could be roads, could be a number of items. But again, I think it was worthwhile. I was supportive of having the concept of roads or transportation on the table because we do need to invest more in roads.
That decision will have to be made during the appropriations process then.
Governor, how concerned are you about this breaking the Republican Party? It has been a firestorm since the Senate vote. A lot of folks in the party very upset with you and those who voted for this. How do you put this back together to get people to move forward?
Can just keep on moving forward. If you go back, we've taken on a lot of tough issues since I've been governor, and as a practical matter, I've had a lot of comments about breaking this or that during the course of taking on a number of these issues. And I view it as you just stay focused on doing the right thing, and you keep communicating with people, and you move forward, and you get back to finding where people find agreement, common ground, and solve problems. So I don't view this as something that it's something you have to be sensitive to. You always want to respect people that had a different approach, but it's something we just need to keep moving Michigan forward.
Even if you hit your targets on Medicaid enrollment and people who buy their own coverage on the exchanges, there will still be somewhere in the neighborhood of 200,000 uninsured Michiganders, people who I guess choose to pay the penalty rather than buy insurance. Do you have any plans to try and somehow capture that group into some kind of coverage?
Well, again, I think people are going to have options. They're going to have Healthy Michigan, they're going to have exchange, and as you said, Rick, there are people that may decide not to. I think it's prudent on our part to offer it because I think they're good offerings, but if people elect not to do that, that's a decision they make. It's not to force them into something. It's basically to say, here are a series of programs that are good options. I mean, one of the concerns I have is Healthy Michigan, I think, is a good thing. I still have serious concerns about the launch of the insurance exchange in terms of timeliness and how well that's going to work, because I think that's a huge undertaking that the federal government is responsible for.
Does Michigan have a backup plan if the federal government is not prepared on their side for the launch of the health exchange?
Well, again, the health exchange is a federal government issue, so that's something we'll just have to make sure we're communicating, because again, it will create concern among Michigan citizens, and I get concerned about that. So we just have to make sure we're having a good, clear dialogue and trying to facilitate making sure people know what their opportunities are and how best to connect with those.
Some states have developed backup plans, though. I think particularly Oregon have developed backup plans because they're concerned that the federal government might not be prepared, for the launch. So I'm just wondering, what Michigan is going to do, or if there is any concern that the federal government might not be concerned to implement the health exchange.
Yeah, well, that's what we're going to have to watch. Again, we don't have the resources to do much. What we can do is help communicate well in terms of the federal health exchange. I've always had concerns about some of the Affordable Care Act, and one of the areas I do have concern is just the ability to launch a health exchange from the federal government side. That's why my preference was to have a state exchange. If people still ask me, that would have been my preference.
Have you printed "I told you so" cards?
I don't do those kind of things. That's not relentless positive action. I just try to point out that there are other alternatives to solve a problem. Right?
Governor,
as you know.
Governor, without partnering with the federal government on that exchange, what role can or will the state play in the next few months helping people sign up for coverage?
On the health exchange specifically,
Yeah.
I think what we're going to try to do is, one, we still want to be helpful in some regard because people will have questions about where they even go to sign up. So as we're contacted, hopefully we can make sure we can facilitate the connection with the appropriate people at the federal government. So it's really helping be a facilitator role in terms of, hey, here's the place you need to go, here's some basic information, but please go there, and how we can help show them the different options, because again, you have a case, are you going to do it online, over the phone, what alternatives they have, how to make it effective in that regard.
Will the state need to fund any additional outreach efforts?
Again, that wasn't part of our budget. We don't have the resources to do that, so we're just going to try to be helpful in this process. And again, I think Healthy Michigan, I have confidence in our team that we're going to do good work. I have some concern at the federal government level with the healthcare exchange, just because being an old IT person, I'm not quite sure how they're going to get all those things in place in the time frame they set. And I've been consistent about that for 2 years now.
So you won't be asking for a supplemental appropriation to promote and publicize the Medicaid expansion, Medicaid option?
Again, that's Medicaid. That's Healthy Michigan. Healthy Michigan, we're doing our work on that. And again, I don't call that a supplemental. That's part of the appropriation that was in this bill. And that's just something we'll have to monitor as we get through this whole process of waivers and everything else and launching the program.
But do you anticipate that the department or the state will need to do some sort of a educational effort so that those who are newly eligible for Medicaid will be aware of that?
Yeah, I think we're gonna have to be proactive on the outreach, and we plan to be. Again, that's different than the healthcare exchange. So this is where, one of the confusing parts of this whole thing is you have to separate what's Healthy Michigan and / Medicaid expansion done right from a healthcare exchange, which is a totally different topic.
Since
Tell me about where you're at.
Okay, hang on. Rick, I'm gonna go to Kathy because she's been waiting very patiently over here, and then I have time for one other question, and it's gonna be either Chris or Dave on this side. You guys are wrestling.
Have you been able to figure out if you can sign people up before it actually goes into effect? Or do you have to wait until April to start signing people up?
I think right now, we're gonna sit back and talk with the federal government on the waiver, what they plan to do October 1, what they plan to say when people call the 800 number. Those are all details that need to be worked out.
And can you start signing people up, can you start signing people up until, before the waiver is granted or not granted?
Well, we gotta wait till the waiver is done, then we gotta start taking a look at the timetable. If we begin signing people up, but they don't get the card until April 1, that might be an option. So let's take a look at what our options will be. And I gotta tell you, CMS and HHS has been really cooperative and going over the various drafts of the waiver. They've been good and clear in their instructions and their questions. And now that it's through the House today, it was concurred, now we can really move into some active discussion with them. And that's what we plan to do.
All right, thanks, either Dave or Chris. We got one last question over here.
I was just going to ask, how long do you expect the Medicaid expansion to last? I think there's a trigger in the bill where this would essentially end when the savings are not offset and it starts to actually cost money to the state down the line.
Well, I think it'll last. If you look at the Michigan model in particular, that's one thing that I think hopefully people will see over time is, I think Medicaid, historically, Michigan's run one of the best programs. And I want to, again, Jim and his team have done a great job of that, going in his prior life and coming back again. We run Medicaid very efficiently in Michigan. We leverage the private sector as part of that process. I think there could be bigger issues in other states. I expect to see Michigan be at the forefront of having well-run programs that are efficient, that take into account how to be more effective and helpful and really show savings through this process.